Hello friends, welcome back to Complete Medical Coding. Today I'm here with more mock questions, some important mock questions including ICD. Okay, so let's directly move to the questions. Let's discuss few guidelines and few mock questions from the previous year CPC examination. Okay, so moving on to the questions one by one. So moving to the first question. Jacob had an upper respiratory viral illness with severe coughing few weeks ago. The symptoms were resolved last week. A few days later, after a bad coughing, he developed hiccups occurring periodically throughout the day and night. He is seen by his PCP. PCP means primary care physician. Okay. And the hiccups are determined to be physical origin related to severe episodes of coughing. What ICD-10 CM codes are reported? So here the patient was having severe coughing few weeks ago, and then all those symptoms have been resolved last week. But then after resolving also, even after few days, because of some bad coughing, he developed hiccups. Okay, occurring periodically, day and night. So he has gone to the primary care physician and determined, and the physician told that that's just because of the frequent episodes of coughing. So in this case, what ICD code you should report? Okay. So let's so first you need to understand what exactly is happening here and what is the cause of hiccups. Yes, it is coughing, but because of severe coughing, why the hiccups occurs? It's only because of breathlessness, breathing difficulty, right? How is hiccups happening? Because of breathing difficulty while coughing. So you have to code for the breathing difficulty. Okay. So let's go to the options. What is B33.0? Open ICD code book. Go to B33.0. B33.0 is epidemic myalgia. Epidemic myalgia, like body pain. Myalgia means more body pain. So this is not body pain. Second option, what is R06.0? R06.0 is dyspnea. Dyspnea means shortness of breath. Okay, the meaning of dyspnea is shortness of breath. What is option C? B34.9, viral infection unspecified. It's written here viral illness, but that was resolved last week. Now only cough is there, so you cannot code for viral infection. What is F45.8? Other somatoform disorders. F45.8 is other somatoform disorders. That's also incorrect. So hiccups is the main cause of his like currently he's having hiccups. So hiccups is mainly caused by breathing difficulty because of cough. So you have to code for the breathing difficulty. Okay. So the correct code here is dyspnea, which means shortness of breath. So the answer is option B, R06.0. You can code for cough also, but because of cough, the patient developed hiccups. And for that, like continuous hiccups. So for that, the patient has gone to see the PCP, primary care physician. So you have to code for shortness of breath. Okay. So the answer is option B, R06.0, dyspnea. Now moving to the second question. A 45-year-old male on examination has a couple thyroid nodules without clinical symptoms of hyperthyroidism. Blood TFT means thyroid function test. Okay. Blood thyroid function test indicate euthyroidism. Physician images the thyroid gland by intravenously administering radioiodine. Multiple images are acquired from different angles and documenting in patient's position. The vascular flow in around the nodules are looked at to determine benign from malignant flow characteristics. What radiology code is reported? So here, physician images the thyroid gland by intravenously administering radioiodine. So here, The procedure is thyroid imaging, right? Thyroid imaging by the physician. Okay, images taken by the thyroid, of the thyroid gland by the physician. And then vascular flow around the nodules has been observed. So you have to match everything. Anyway, let's look into the codes, options one by one. What is the first one? 78015. Go to 78015 in CPT code book. 78015 is thyroid carcinoma, metastasis imaging, limited area. Example, neck and chest only. Yes, thyroid is in the neck. So, neck and chest only. Neck and chest. Neck is the one that you have to quote. But what is the description? Thyroid carcinoma metastasis imaging. Here it's mentioned in the question. Vascular flow in around the muscles are looked to determine benign from malignant flow. It's just to determine whether it's benign or malignant. But it's not confirmed that it's a malignant. Okay, so thyroid carcinoma, you cannot quote that because this is not carcinoma. Now, what is 78070? Second option, 78070 is parathyroid planar imaging, including subtraction when performed. Parathyroid planar imaging. No, this is direct thyroid imaging. Okay, so you can't quote that also. Now, what are options C and D? 78012 and 78013. 78012 is thyroid uptake, single or multiple quantitative measurements, including stimulation, suppression, or discharge when performed. No, not thyroid uptake. That's also wrong. So, what is 78013? That is what we need exactly. Thyroid imaging, including vascular flow when performed. Yes, vascular flow. So, thyroid imaging, including vascular flow is the procedure done here. So, the correct answer is option D. Okay, 78013. Thyroid imaging, including vascular flow. Now, moving to the third question. A 60-year-old patient with known AIDS saw his orthopedician today for severe pain in the right knee. The physician documents that his knee pain is due to a flare-up of post-traumatic osteoarthritis, and he gives him a cortisone injection in the right knee joint. The osteoarthritis is not related to AIDS. What ICD-10 codes are reported? Okay. So here the patient is having AIDS. The patient is a known case of HIV. Okay. And then, but the patient is here to see the orthopedic for what problem, what condition? For his pain in the right knee. Pain in right knee. And then the orthopedician confirms that he is having post-traumatic osteoarthritis. He has diagnosed as not only osteoarthritis, post-traumatic osteoarthritis. That is the exact diagnosis. Okay, so you have to code for post-traumatic osteoarthritis. Okay, and then he gave him a cortisone injection. Anyway, they have not asked for the procedure. Here, post-traumatic osteoarthritis of right knee is the diagnosis, along with HIV, because HIV patient will be having HIV, right? Till his death. So you have to always code for HIV. But since the patient is here, not to show about the HIV, but about the AIDS, but for the osteoarthritis problem, for the knee problem. So you have to first code for post-traumatic osteoarthritis of right knee along with HIV. Okay. So let's look into the options. First one, what is Z21? Option A, Z21 is asymptomatic HIV. Z21 code represents asymptomatic HIV. Anyway, Z code should not be the primary, and because the patient is not here to treat HIV, so that is wrong. So no need to go to the other code. Now go to option B, M17.11. What is M17.11? Unilateral primary osteoarthritis right knee. Unilateral primary osteoarthritis right knee. And B20 means HIV. Okay, HIV disease. Means a known case of HIV disease. This is osteoarthritis, but not primary osteoarthritis. This is post-traumatic osteoarthritis. So that code is also incorrect. Moving to option C, M17.31. What is M17.31? This is what we need. Unilateral post-traumatic osteoarthritis of right knee. Yes, post-traumatic osteoarthritis of right knee. Unilateral. This is what we need along with the HIV code B20. Okay. If you move to option D, they have put these two codes in the the other order. B20 HIV in the beginning and M17.31 post-traumatic osteoarthritis. So you always have to code for what the patient is here to treat, because he's here to treat osteoarthritis or he's here to treat the right knee pain. To show the right knee pain, you have to code M17.31 first. So the answer is option C. Okay, M17.31 along with HIV code B20. Okay, if you have any doubt, you can mark in the comments. I'll get back to you soon. Okay. Now moving to the fourth question. A 33-year-old female is 29 weeks pregnant, coming to check her blood sugar. She has had type 2 DM, type 2 diabetes, okay, for the past 2 years. Select the appropriate ICD-10-CM codes for this encounter. So here the patient was having DM since 2 years. But she's right now pregnant with 29 weeks and then she's here to check the blood sugar. If they have asked for the CPT procedure code, you have to code for the blood sugar code also, 82948 or 82947, whatever it is. Okay. But since the patient, the question is asking only for the diagnosis, you don't have to code the sugar. So instead, we have to code only the diagnosis. So here you have to first code for, see, for pregnancy, whatever the condition is, you have to always code for, you have to always use O code. O code as the primary, okay, along with the other codes, and then the number of weeks gestational number of weeks of gestation also at the last. So O code should be primary. So since O code is primary, we will just go to the options C and D only. We can directly skip options A and B because that is wrong. So what is option C? O24.113. So let's find out which O code is right. If it is option C or D. O24.113. What is O24.113? Pre-existing type 2 diabetes mellitus in pregnancy, third trimester. Yes, this is third trimester because 29 weeks. So from 28 weeks till the end, it is third trimester. Okay. So this is third trimester and pre-existing type 2. If you go to option D, the other O code, O24.419. What is O24.419? If you check the description, don't be confused. O24.419 is gestational diabetes mellitus in pregnancy, unspecified control. This is not gestational diabetes because the patient was already having diabetes 2 years before. Okay. She has had, means she was having diabetes since 2 years. It's not like a history. Since 2 years, she's having diabetes. So you can't code for gestational diabetes. This is not the diabetes which occurred in pregnancy, but she's already having. So you can't code gestational diabetes. So the correct answer will be option C, O24.113. Okay. What is O24.113? Which means pre-existing diabetes. So she's already having. So it means it is pre-existing. So pre-existing type 2 diabetes in pregnancy, third trimester, along with E11.9. You have to code for E11.9 because this is a diabetes which she is already having. So E11.9, DM type 2, along with the number of weeks, Z3A.29, 29 weeks gestation. Okay. So answer is option C. Like this, you have to code for the pregnancy codes. Okay. Now, fifth question. A mother brings her 3-year-old child to the pediatrician's office after stuck up with a small bead in his nostril. The pediatrician uses a nasal decongestant to open the blocked nostril and removes the bead with nasal forceps. What CPT code is reported? So here the patient is 3-year-old and then patient is here with a small bead stuck in the nostril. Here it's not mentioned which nostril, nothing is mentioned. Just mentioned nostril. And then the pediatrician uses some nasal congestant, decongestant to open that blocked nostril and then he removes. So what code you should report? So only 2 codes are mentioned in the options. One is with modifier bilateral and one is without modifier. Let's look into those 2 codes, 30210 and 30300. Okay. What is 30210? 30210 is displacement therapy provides type. Displacement, no displacement here. What displacement? Nothing. So that is wrong. This is a simple question. Okay. What is 30300? 30300 is the removal of foreign body intranasal office type procedure. So here the patient in the pediatrician's office, the procedure is being carried out by removing the foreign body, removing the bead. It means a foreign body. So correct code is, we got the correct code 30300, removal of foreign body intranasal office type procedure. Should we add modifier 50 bilateral? That is what now you have to find out. In the question nothing is mentioned, even in the description nothing is mentioned to append modifier 50 or for bilateral, nothing is mentioned. Okay, so it means no need to add modifier 50. If it is required, they will mention it in the description down in the brackets. Since nothing is mentioned, you have to code only 30300. So the correct answer is option C, 30300 for the removal of foreign body intranasal office type procedure. Okay. So friends, hope you like this video. If you have any queries, please mark it in the comments and I'll be coming back with more mock questions frequently. Because of some personal issues, I couldn't make up more mock questions in these few days. But I'll be back with at least 2 to 3 mock questions in a week. Okay. So stay tuned. I'm trying to get more questions from the recent years, previous years, like last year question papers. So stay tuned for more videos. If you are new to the channel, please support me by subscribing to my channel. Okay, and please press the bell button so that you will not miss out any videos. You will get all the notifications. And that's it. So stay tuned. Thank you so much and thank you so much for all your support as of now. Take care friends. Bye.